Hello everyone, welcome to MR CPCH Made Easy. So in this session, we'll be discussing how to take history for development station. So this is the exam circuit for the clinical exam. So there are 10 stations and the development station is the fifth station. So the candidate can get either red or blue station. So the time allotted for the development station is 22 minutes. So what's the main aim of this station? So the main aim of RCPCH is to assess the candidate's ability to take a focused development history and describe how they would undertake an assessment around key areas of development with the examiner. So in this station, there will not be any child. So you have to do developmental assessment with the examiner. And you have to take the history from the role player. So role player, you will be taking the history and developmental assessment, you will be doing with the examiner. So before the candidate enters the room, the candidate information sheet will be given to the candidate. So the information states the background information and the task required to perform. So 4 minutes will be the waiting time outside. So during the 4 minutes, the candidate can read the information and write the format for history and assessment. So if the candidate does not understand the task, then the candidate can ask the examiner for the clarification. So this is how is the development flow chart looks like. So during the first 4 minutes, the candidate will wait outside the room. So the candidate will be given the candidate information sheet. So if required, any photos and other cues will be given. And it's after completing 4 minutes, the candidate will enter the station. So when the candidate enters the station, the examiner will introduce self and also the role player. An examiner will provide the brief introductory statement about the task, and examiner will ask the candidate to take a focused history from the role player. So there will not be any child in this station. So candidate is supposed to take the history from the role player. Role player will act as a caregiver. So, first 9 minutes, the candidate will be taking history from the role player. So, at the end of 6 minutes, there will be a warning bell that 3 minutes are left. So, total 9 minutes will be given for the candidate to take the focused history from the role player. So, after taking the history, at the end of the 9 minutes, the role player will leave the room. So, after that, the candidate is supposed to summarize the findings to the examiner, and the 1 minute will be given to summarize the key findings from the history. So, after summarizing the history and the task for the development, the assessment will be with the examiner. So, in the 9 minutes, the candidate is supposed to do the developmental assessment with the examiner. And the warning bell will be in the last 3 minutes after 6 minutes. So total 9 minutes for the assessment. So next, after completing the developmental assessment, 3 minutes will be left with the examiner to do the discussion. with the examiner. You need to summarize the case and also give the differential diagnosis and most likely diagnosis. And the questions will be asked about the investigations and management. And at the end of 22 minutes, the helper will announce that the station is over and candidate will move on to the next station. So some toys and the tools will be provided at the station. You need not carry any toys or the tools in the developmental station. So what is expected from the candidate? So the candidate will be expected to outline the main areas of the management and also demonstrate the knowledge and also the roles of the multidisciplinary team. So there will be a multidisciplinary team managing the managing the child. So you need to know the role of each member of the team. So this is how the scenario looks like for the developmental station. This is the example one. Joy is 4 year old. He was born at 25 weeks of gestation and has cerebral palsy. Please take a relevant developmental history. During discussion with the examiner, your approach to the clinical evaluation of NOASP, fine motor skills will be assessed. During the history taking, you may not ask direct question about the task. This is how the scenarios will be given outside the station in the candidate information leaflet. So this is how is the mark sheet for the developmental station looks like. So here is the candidate number. You need to enter this, mark this with a pencil, and the candidate name should be written here. And this all will be marks will be filled by the examiner according to your performance. So the candidate will be given a paper and the pencil. Sorry, not the pen. Pencil will be provided. So when the candidate is waiting outside the room, so when the candidate is supposed to write the name of the mother and name, gender, and age of the child, and short background of the information provided in the sheet, and the task which candidate is supposed to perform. If you write this in detail, there will not be any confusion, especially when you're in stress. It doesn't look good after you enter the room, you ask the name of the mother. So better you write the name of the mother in prior so that there is no confusion. And if you have time, better to write a short format and also write the most likely diagnosis so that you will not miss any points. So once you enter the room, what the candidate is supposed to do? So once candidate enters the room, wish the examiner and also the parent, and introduce yourself, and definitely examiner will definitely wish you, and also examiner also introduce you to the role player. Then once you start taking the before you start taking the history, you always introduce yourself to the mother and confirm the identity of the mother and the child, and also confirm that after you introduce wish the parent and clarify your role and ask for the permission. So these are the initial steps. So you will wish the examiner and the parent and introduce yourself to the role player and confirm the identity of the parent and the child and clarify your role that you're going to take the history and ask for the permission for the assessment there itself. So let's see what history you should take in a case of development station. So first is history of presenting illness. So, history of presenting illness always start with an open-ended question. So, open-ended question is ask the mother, for example, the child's name is John. So, ask the mother, can you please describe your concern for John? Ask and always put an open-ended question. If after that you can ask other questions. So first question should be an open-ended question. Then also ask onset, course, and duration. Like how is the problem started, when did it started, how did it start, and what happened after that. Okay, onset, course, and duration. And also ask if the child has any other behavioral abnormalities, and also ask if any other unusual movements or abnormal movements in any part of the body. Ask whether John has or the child has lost any skills he has lost recently, or is there any delay in acquiring skills compared to other children of the same age. And ask if there is any concern about the hearing and vision. Very important. Always ask if there is any concern about the hearing and vision. And how ask about how is the child's daily routine, because asking about this will tell you about if some children with rigid routine, you can identify autism and other behavioral disorders like ADHD. All right. And if it is a case of autism, and ask further questions like if the child wants to be always alone, whether he makes an eye contact, how is the interaction, will the child interact, what if his favorite toy is taken away, how does he react, does he throw any tantrum, is there any abnormal reaction to touch, smell, and other noise, is there any child's sleep disturbance? Did he anytime do self harm? And does he express the needs? And if it is ADHD, if you're suspecting ADHD, ask questions. How is he? Can he concentrate on the task? Does he do any careless mistakes? And does he forget things easily? And does he face difficulties in making friends? Will he? Does he wait for his turn or not? To identify ADHD. And after that, you ask questions related to the it's to find out the cause for the developmental delay or whatever the history is given, the scenario is given accordingly. Ask if there is a concern regarding his head size, if there was any seizures in the past, was there any head trauma or head injuries in the past. Ask if there are any meningitis. So how to ask? Don't ask meningitis. You can ask if there is any bugs in the head, any skin marks to find out any neurocutaneous syndromes. And the questions about thyroid disease, you can ask like. Is there any colon sensitivity to the cold? How is his bowels? And any other questions related to the thyroid, any neck swellings you can ask, right, for the thyroid disease. And any recurrent ear infections. In case of speech delays, you can ask about recurrent ear infections. And if the mother tells that the child has seizures, then you need to put further questions to inquire when it was diagnosed, where it was diagnosed, what medication was given, um, anytime drug level was done, and any side effects of the drugs they have noticed, and when was the last seizure, whether see in UK if there's and some conditions they wear the bracelets, medical alert bracelet, and seizure is one of them. So inquire if he's wearing the bracelet, and if they have any emergency plan, any home modifications done for that. And also ask about any bony deformities or weakness, especially in case of rickets. You need to ask bony deformities and weakness. And ask if he's dry by night, how is his pee and poo. Don't ask urine or stool. You can ask pee or poo. They won't understand urine or stool. So it's better to ask is if mother has any concern regarding the child's pee or poo. And to find out any syndromes, you need to ask whether the child looks like you or daddy, or do you notice any unusual facial features. So after mother gives the history, finally you ask, what did you do for that? whether she has consulted a GP or she what actually she has done for that inquire. Unless until you ask, she's not going to tell you. Then also you need to ask questions related to the development of the domains other than the task. Don't ask questions related to the task. You should never ask questions related to the task. So, for example, your task is about the gross motor. So, during the history, you should not ask any questions related to the gross motor. Like, can the child walk? Can the child sit? Can a child run? So all these comes in gross motor developmental assessment. So those questions should not be asked in the history. So even if you're going to ask, the mother is not going to tell you because they're already prepared to not answer these questions. So it doesn't give a good impression. So never ask history related to the task domain. So for the speech, you can ask, can he sing a song or can he tell a story or how many colors he knows? And can he tell his full name? And this is for the expressive speech. And for the receptive speech, can he follow the orders? Can he knows the opposites? Okay, for the receptive speech. So you need to ask only one or two, at least 2 to 3 questions, not more than that, because you need to manage the time as well. So for the social, just ask how does he play? How does the child play? Does he share his toys? And is he dry by day or night? And how can he dress himself? Can he feed himself? Okay. And for the fine motor, ask if I give him a cube, so what is he going to do? Can he make a tower? Can he make a bridge according to the what according to the age we need to frame out the questions. And can he take if you give him a book, can he turn out the pages? And how does he turn the pages? You can ask. Okay, if it is a gross motor, can he ride a tricycle? Can he walk? Can he run tiptoes? So these questions you need to ask according to the age of the child. So please don't ask like if the child is 1 year old child, you cannot ask, can he ride a tricycle, right? So instead you can ask, can he stand? Right. So you need to put two to relevant 2 to 3 questions to cover the other domains. So this is all about history of presenting illness. Now the past history. In the past history, ask if there are any underlying health issues that might be causing developmental delays, or is there any team involved in managing the child's condition, or is there any history of any trauma or head injuries? Trauma or head injuries, you can ask in the present illness itself. If you have forgotten there, then you can ask in the past history. In the transfusions, any previous transfusions, like in sickle cell anemia, with requiring previous transfusions, now presenting to with stroke, such cases can also be kept in the exam. So you need to find out. So any tests done previously, investigations done previously, any operations done previously, you need to ask. Like for the shunt surgery, if the mother says like shunt was surgery was done, and then ask when was done, why it was done, is there any problems, who takes care of the shunt, all that you need to ask. So any admissions previously in the hospital, any allergies, you need to inquire. So for the birth history, uh, so history of present illness, past history, and then the birth history. Antenatal. Antenatal, ask age of the mother during conception. Don't ask age of the mother during at the time of marriage, but ask age of the mother. That relevant the questions you need to ask. Age of the mother during conception. If you don't mind, can you please tell me your age during pregnancy? You can ask. Or you have any fever, any illness during pregnancy? Did you what medications you have taken? And when you're asking about alcohol or smoking, you need to lower your tone and don't ask in a high tone. Like ask is it okay if I ask you some of the personal questions so that it will for the best interest of the child? Uh, so don't always tell the child or something. The name will be given the scenario. Just tell the name of the child so that gives a good impression. So suppose The mother's name is Maya. So you can ask Maya, if you don't mind, can I ask you some personal questions for the best interest of your child, John? So that is how you need to ask, inquire when you are talking about if she has taken any alcohol, smoking, or any drugs during pregnancy, because that is very important. Because during my exam, it was a case of fetal alcohol syndrome. So if I had not asked this question, I would have missed the diagnosis. So asking each and every question and relevant question is very important. So how were the scans done? So if you tell ultrasound scan, so those role players will not understand. So instead, you can tell uh, jelly scan. So they call it as jelly scan. The UK people, they can easily understand what jelly scan means, and you can ask if the jelly scan's done and how were the results. So any miscarriages or any deaths previously, you need to inquire. So, in the natal history, ask how was the baby delivered? Was the baby delivered on time to find out whether the baby is term baby or the preterm baby? And mode of birth, whether it is a instrumental delivery or not, whether the baby cried at birth or not, and any concern at the time of birth, any resuscitation required, any support needed any at the time of birth, what was the birth weight, any baby care unit admissions was necessary or not. So postnatal, ask any baby care unit admissions. Instead of NICU admissions, you can tell baby care unit admissions. If at all admission was there, inquire the duration of the admission, whether the baby was put on breathing machine, and if at all yes, then inquire for how long. Was there any fever? Was there any fits? Was there any unusual yellowish color of the skin to find out the jaundice? Blood changed or not? Exchange transfusions. For exchange transfusion, you can ask if the blood was changed and any other test was done. And if the child was admitted and medication was given, inquire what medication was given, because very important. The child with meningitis or sepsis, they might have given amikacin or that can cause hearing impairment. So you need to find out the particular medication if you need to inquire about it. And jelly scan of the head, this is a neurosonogram of the head, and any test done, and how was the blood sugars, whether the child had any hypoglycemia or not, any transfusions was done to the baby or not, and ask in detail about the newborn screening, the instead, you can ask heel prick test and hearing screen and vision screen and hip screen, whether the baby was breastfed or not, any baby had any feeding difficulties or not. Okay, if you have time, you can ask about the immunization. You can keep it to the end. And nutrition, yes, if the baby has CP child, and how was the baby feeding? Was NG tube? Is it the baby feeds by through the NG tube or any concern about the nutrition? Dietitian is involved or not? You can ask any concern about the weight and height in the group. You can inquire. In the family history, you can just put an open-ended question like, can you please describe me your family and how many members in the family, whether it's a consanguineous marriage or not. You can ask whether you and your partner or husband are blood related. Is there any similar illness in the family? Any medical condition in the family? How many languages spoken at home, especially if it's a case of speech delay? And what do you do for a living? Inquire the job and also the job of the partner, the husband, and ask if they're satisfied with the income. Is there any financial constraints at home or any significant changes at home? You need to inquire. And who takes care of the child when you're at work? If the working mother, just inquire who takes care of the children if mother is at work. And if the mother is with the child to the came to the hospital, then ask who takes care of the other sibling, or sit with the other sibling if the mother is with the child. how does the condition affects the child, and the impact is very important. You need to find out the impact of the child's condition on the family. How does the condition affect the child and your family, and how are you coping with it? You have to be very empathetic. You have to be very empathetic. You need to uh, uh, always nod your head and try to say like, I'm so sorry to hear if the mother is giving any bad news or anything. Always be empathetic in talking to the mother, because that also will be considered for the evaluation. Also inquire about any family stress, and if she's in stress, or if she says that she's anxious and depressed about it, and ask if she has joined any local support groups, um, and they have any emergency plan, or immediate access to the emergency room. And ask how is the environment at home, is it stressful or not, any modifications done at home, old, and is there any in developmental regression and delays, you can ask, is there any old pipes or new pipes for the lead poisoning, and any significant changes done at significant changes at home, any stressful events at home, you need to inquire. And social history is very important in UK history taking. Just inquire if they are getting any financial assistance or financial support, and or any other social support. You need to inquire on emotional support they are getting, or social workers are involved, or they join any support groups, local support groups. If not asked before, you need to ask this and stress a lot on this, and whether the family receives any disability living allowances or not. And lastly, the schooling history is very important. Just inquire if the child goes to the mainstream school or the special school. Child with the special needs will go to the special school. So inquire. The type of the school is very important. And yes, the level of the school the child is going, and how is his school performance, whether he likes to go to school, and does he get along with the friends, does he like playing with his friends or not, you need to inquire. And also if you feel like the child has special needs, then inquire any education assessment was done, and any educational health care plan was taken or not, you need to inquire. How are the teachers? Teachers are then do they know about the child's condition? If the child is having seizures, so how are they going to manage? Are the teachers aware of the child's condition? You need to inquire. And also inquire if there is any bullying at school. Very important. Child with developmental delay will be usually at risk of bullying at school, so you need to inquire about this. So, so that's all. This is how you need to take history, and you need to summarize the key findings, and you summarize in a chronological order, and tell about the positive findings and important negative findings, and also tell about the age, the chronological age, and also the developmental age which you are giving. Yeah, I'm going to give John the so and so age, basing on the so and so questions from the domains, because the child can do this, child cannot do this. So also give the clinical reasoning or justification why you're giving so and so developmental age for that child. Okay, so that completes the history taking for the uh, developmental station. Okay. Thank you.